Hello everyone, my name is Adam. I'm one of the audiologists at Alto Hearing, and I'm back today to bring you another earwax removal directly from our clinic in Lutterworth, UK, and now also Kenilworth, UK, which is part of the reason I haven't been around much over the last month, because I've been too busy setting up this new clinic, and whilst it has been very enjoyable and a lot of hard work, I'm definitely glad to be back with you here today looking at videos of earwax being removed. If you wouldn't mind taking a moment to click like on the video if you enjoy the content, and subscribe to our channel to make sure you don't miss any videos coming up soon. We really appreciate your support. So we do have some good ones for you today. Mariia has been hard at work, and it is her birthday today, by the way, so happy birthday, Mariia. Now, we've got two patients in the video today. So first up we have a lady who was double blocked up, and when I say blocked up, in fact, both of these videos are pretty similar in terms of blocked ears. I mean, really blocked up. She was struggling to hear and was feeling a lot of pressure in both of the ears, but Mariia was on hand to help her remove it all using microsuction. Now, sometimes people say, how can you let your ears get blocked up like this? I mean, the truth is, it happens to the best of us. Factors like age, genetics, and the shape of our ear canals can contribute to earwax buildup, and it's rarely, if ever, anything to do with personal hygiene. The important thing is recognizing when it's time to seek professional help, like our patients did here today. This first one really had got to a stage where this lady was really struggling to hear, and that is a surefire sign that it's definitely worth someone looking at your ears. Sometimes it might be a feeling of fullness, or maybe you might experience some tinnitus. There's not one way to tell you're blocked up with earwax. I've had a few scenarios myself over the last few days though, where people have come to us as sort of last resort after trying some homemade methods, and it's not been pretty. It's much easier with ones like these, where whilst it's a lot of earwax, we're able to safely remove it and the patient feels amazing after. Now, whilst I'm on the subject, you might think that we have to deal with people who have stuck cotton buds down their ears all the time, and whilst that is true, we do hear that a lot. There's looking like a new contender recently for the most commonly used household implement badly used to try and remove earwax, and it is the humble hair grip. Now, you're looking at a man who lives with 3 females, and I'm not a stranger to finding these things all over my house. And I'm not gonna lie, if you've got a bit of an itchy ear, it is very tempting to stick one of those things down your ear hole and have a bit of a wiggle to see what comes out. But that is a bad idea for many different reasons. One, it's dirty. I mean, your ear is a very delicate environment, susceptible to infections quite easily if you're prodding around in there. Also, someone might have had the same idea as you, poked it down their ear and put it back. You just never know. And two, you can't see what you're doing. You're kind of reliant on feel. And when you're reliant on feel, you tend to use pain as your guidance, right? You've gone a bit too far in, you scream in pain, and you come back out. Weirdly enough, if you're experiencing pain, you're likely to have done some damage. Now, I know in the comments someone will inevitably write, I've been using hair grips to get wax out of my ears for 37 years and my wife says my ears are sparkling. Congratulations, but trust me on this one, keep the hair grips out of your ear. Just trying to think of other things people have said they've put down their ears. Cotton buds and hair grips are definitely the main two. Bic pen lids are up there, and I've seen those cause problems. Car keys are another one that deserve a mention. They're all stupid. Keep things out of your ears, and if you get a buildup of earwax, if it's not coming out naturally, book in with a professional who can remove it safely and effectively. Anyway, so back to the video. Now, one of the questions we get asked a lot is, when do you use tools and when do you use microsuction? As you can see in this video, Mariia is just using microsuction today, no tools necessary. And the answer is, it really depends on each person. We've always got all the tools laid out on the table by us, so that'll be the crocodile forceps, Jobson horns, and the hooks alongside a few other bits and bobs, and we have irrigation on hand too, which is super useful should we need it. I've seen quite a lot of patients in the Kenilworth clinic who have got really soggy, mushed up earwax, and I think it's because one of the GPs or medical professionals around there must be recommending Otex Express, which is basically hydrogen peroxide, and it causes an absolute mess in people's ears. It's quite aggressive and often doesn't remove all of the earwax, it just leaves a white gloopy residue that's quite tricky to pick up with microsuction, and you often find that irrigation is the best way to clear stuff like that out. But as for choosing tools versus microsuction, it really is down to how easy we're finding it to remove and what feedback we're getting from the patient at the time. You just get a feel for it after a while. If we can do everything with the Zollner tube, like in these ones here, is absolutely fine. And if we need to use tools to make it a bit easier or quicker, then that's fine too. There really is no right way to remove earwax, as long as it is comfortable for the patient and most importantly safe, leading to a positive end result. That is what matters. Whilst we're on the subject of questions, we had another question the other day, and that was, what questions do you ask people prior to doing earwax removal? So before an earwax removal appointment, the patient will be given a consent form to read and sign. This sort of spells out all of the risks and procedures and just makes sure they're happy for us to continue. Once they've signed that, they'll come in and speak to one of our clinicians. The clinician will take a bit of a history from them, and what we're looking for here is any contraindications and things we need to look out for. So we'll ask people if they've had earwax removed before, whether they have any hearing loss or tinnitus. We'll ask if they've had any operations on their ears or any grommets. We want to know whether they've had any tinnitus or balance issues. And we also ask if they're taking any blood thinners. And all of these things just build up a picture for us to be able to go and choose the right method and ensure we're aware of what's going on. Also, after we've done an earwax removal, we'll also do a hearing screen, usually to check for hearing loss and just make sure their hearing's in good shape. Any issues, and we'll refer them for further investigation either with ourselves or a GP. So that's it from us for today. Some really nice work from Mariia on these ones. 2 very relieved and happy patients. Thanks for tuning in. We would really appreciate it if you could like and subscribe to the channel. It really does make a huge difference to us. I'll see you again very soon. Take care.